Hey, so we are back with another segment here. So we're going to dive a little bit more into liver health and what that has to do with hormones as well as digestion and the age-related changes that happen. So I've seen more and more people come to me that have either a risk for fatty liver, so elevated liver enzymes, or they've been diagnosed with fatty liver by their doctor. And I think there's a lot of misinformation and things are misconstrued a bit. People don't really understand what fatty liver is or what causes it. They think it has to do with eating too much fat or something because of the name. So I want to kind of clear that up first. And then we're going to dive into some of the factors and why liver health is so very important for both hormone health and digestion. So first of all, fatty liver develops when the liver is not functioning optimally, and especially when we have high triglycerides. That is a type of cholesterol that forms in our body when our blood sugar is consistently high. So we're having consistently high blood sugar due to either diet and or stress and or microbiome. There's so many factors that can impact that, lack of exercise and muscle mass. And so when our blood sugar is consistently high, now we've developed high triglycerides. And our body says, okay, clearly I don't need all this sugar. I'm going to store some of it as fat. And because of the metabolic processes that go on when this is happening, it ends up storing that fat, those triglycerides in the form of fat in your liver. Okay, so we've got too much triglycerides floating around. The body starts storing it in the liver. And we don't want that to happen because our liver health is very, very important for many reasons. First of all, your liver is used to detoxify things from your body. So anything you bring in that is a toxin, whether that's inhaled, it's food that has pesticides on it, anything at all has to be processed, medications, alcohol, all has to be processed through your liver to be metabolized and excreted from the body in a healthy way. But our liver also does a lot more. So our liver is important for cholesterol levels, but also for digestion and balancing hormones. So our liver produces bile, which gets stored in the gallbladder and released when we eat a meal. And that bile is really important to help emulsify and digest fats. And many people, as we get older, have issues with bile production or excretion or develop gallstones. Very, very common as estrogen levels downregulate and decline, especially women that have been on birth control or people that have SIBO, that small intestine bacterial overgrowth we've talked about before. That's actually a risk factor for developing fatty liver and bile and gallbladder issues. Well, it's all connected. And we know that having this fatty liver is going to make it very hard for your body to do what it needs to do. So your liver is also responsible for building and balancing your sex hormones. So when your sex hormones are out of whack, so say you have too much estrogen, not enough progesterone, or whatever the case may be, your liver is responsible for managing that and sending some out of the body, and so balancing things out, right? A lot of women are estrogen dominant, meaning they have higher estrogen relative to progesterone. And so if the liver can't sense that and do something about it, we're going to have this estrogen dominance, sticking around. We're going to have more hormone-related symptoms, but that also predisposes us to things like weight gain and other illnesses such as cancers and whatnot. So we really want to make sure those hormones are balanced. So optimal liver health is important for digestion, cholesterol levels, so your risk of things like heart disease, and also your hormone levels. And so we actually need estrogen to build bile, produce bile in our liver, and that gets stored in our gallbladder, right? So as our estrogen declines when we enter menopause, we're going to have a harder time with that. So we have to do as much as we can to support the body in producing optimal levels of bile, because we know, as I've talked about before, that bile is important not only for fat digestion and absorption, but it also acts as an antibacterial barrier to prevent you from developing things like SIBO or some dysbiosis in your small intestine, right? So it's kind of an antibacterial barrier between the stomach acid and the bile. They work together to keep that bacteria under control. They also are prokinetic, meaning they're going to help your bowels move. And so if you've got low stomach acid or low bile, you're more likely to become constipated. And we know that constipation worsens things like weight gain, mental health, inflammation. We also know that having that dysbiosis, that bacterial imbalance, especially in the lower gut, can even promote issues like fatty liver. So it all comes back, and everything is impacting each other basically, right? So if we have imbalances in the upper gut, it's impacting the liver is impacting the upper gut in absorption and digestion, whether we develop this dysbiosis. The large intestine, the balance of microbes there is impacting our metabolism, it's impacting our blood sugar, it's impacting our liver health. It's all connected. So I know it sounds really complex, and that's why it's really important to work with a practitioner who knows what they're doing and can help you figure out what you need to focus on so you're not overwhelmed and you're not trying to DIY it. Okay, so what I want to talk about a bit now is, so we have to optimize our liver function. So we do that by balancing our blood sugar so we don't have too much triglycerides and end up with fatty liver, right? So we're eating to balance blood sugar. That means we're eating every 4 hours or so, and we're having a combination of fat, fiber, and protein. These things are digested and absorbed more slowly than things like simple carbs, and that keeps your blood sugar steady and prevents you from developing high blood sugar and insulin resistance, which is a pre-diabetic state. And that state also promotes weight gain. And so as we talked about, the hormone changes that happen in perimenopause and menopause make you more predisposed to developing these conditions. So we really have to keep a handle on this in terms of doing all that we can with diet, exercise, and working with a practitioner if necessary to treat those root causes so we don't develop things, other health conditions such as diabetes or heart disease. Now, the other reason we might develop fatty liver would be long-term use of medications. We talked about the liver is important for processing, metabolizing any kind of chemicals or toxins that come into the body, and that includes drugs. So they have to be metabolized through the liver. Whether this is a prescription drug or an over-the-counter drug, they all have to be metabolized through the liver, and so being on drugs, especially multiple drugs long-term, is going to impact your liver function. So as much as possible, in working on these conditions with a practitioner like myself, because we can make such progress, a lot of people are actually able to come off some of their medications, especially if it's something like a pain medication, a heartburn medication, things like that. And even some people have had success coming off antidepressants. I don't think you should come off them just willy-nilly. You have to be very careful about that, and I would never ask a client to do that if they're not ready. But some people have opted to do that on their own terms, and because we were supporting their gut health, their hormone health, all of these factors that impact mental health, they were able to do that and still feel okay. So we really have to look at these underlying factors, and that allows you to come off some of these medications sometimes. Now, the one thing I want to say too is that we really have to look at absorption. And let's dive a little bit more now into mental health and fatigue. So I see fatigue as one of the biggest issues with my clients. And fatigue, there's a number of causes for that, but we know for sure that one of the biggest ones, especially as we age, we just talked about, how your stomach acid is naturally lower as you get older. You likely don't have enough bile, and your liver is not functioning properly. And especially if you have SIBO, you develop SIBO because of your low stomach acid, because of these antacids you've been taking, because of a poor diet, because of constipation. Once you have that, it's going to impact your absorption, and that's going to impact your energy and your mental health. So how does that work? Absorption takes place in your small intestine. And so if there's anything that's causing inflammation in there, including bacterial overgrowth or SIBO, from low stomach acid, from poor diet, from constipation, all these factors we talked about, once you have that SIBO, that dysbiosis in your small intestine, you're not able to properly absorb and digest the nutrients from your food. So unfortunately, you could be eating a really healthy diet, but you're not absorbing any of the nutrients from that food because you don't have enough stomach acid, enough bile, or enough digestive enzymes, and the sheer fact that there's just so much inflammation going on in there that you're not going to be absorbing things. The other crazy fact with that is that bacteria love to steal your nutrients, especially iron and B vitamins. These are very common nutrient deficiencies, especially in people with chronic gut issues and especially as people are aging. And the reason for that, again, it has to do with absorption, but it also has to do with having SIBO or dysbiosis. Because when you have that bacteria there where they're not supposed to be, in your small intestine, the site of absorption, those bacteria are there and they're stealing your nutrients from you. You're trying to absorb them, but they're in there and they're stealing them from you for their own purposes, right? So what we have to do at that point is kill them off and optimize digestive function. So that means increasing stomach acid and bile in order to prevent them from coming back, but in order to optimize digestion so that you are absorbing all those nutrients that are crucial for both energy and mental health. So we need things like iron, B12, B6, magnesium. These are all things that are needed to both build happy hormones like serotonin and dopamine in our brain and to give us energy, right? And even just the macronutrients from our food, the carbs, fat, and protein that we are eating, if we're obviously not absorbing it very well, we're not going to get energy, right? Energy comes from food and from optimal digestion and from your body being able to turn that food into energy. So if you can't do that because something along the way is not working, whether that's your small intestine, your stomach acid levels, whatever it may be, that's going to cause fatigue, right? We also know that systemic inflammation causes fatigue due to your body's inability to produce what's called ATP. So if you remember back from high school, ATP is the energy currency of the body and it's produced in your cells. And so we need everything to be functioning optimally to be producing ATP properly. So we need low levels of inflammation. We need all of our nutrients to be in check. So things like vitamin C and lots of antioxidants and B vitamins. And we need all of these things to be present and functioning optimally in order to have that process take place within the cell and be making and using that ATP. When we have too much inflammation, our body is busy trying to put out that fire of inflammation, and it's using up all of our antioxidants and all of our nutrients to do that. And so the cells aren't getting what they need to make that ATP. So now you're deficient in ATP, of course you're going to be tired. That's the energy currency of the body, right? And on top of that, not only do you not have the ATP, but now you've got high levels of inflammation. So where is all this inflammation coming from? When people say we have inflammation, it doesn't just exist, right? It has to be coming from somewhere. We have to understand where it's coming from and what we can do about it. A lot of people, their inflammation is coming from one of two major sources. One is imbalanced blood sugar, which we talked about, and the other is your microbiome. So when you have dysbiosis or bacterial imbalance or overgrowth in the gut, so too much bad guys, they're going to be causing inflammation, but that inflammation does not just stay in the gut, okay? It enters your circulation and causes inflammation systemically in your whole body and your brain. So that's one of the ways in which your gut is causing fatigue and impacting your mental health. So what we have to do is get to the root of that inflammation by balancing out your gut bacteria, bringing down the inflammation in the gut so that we can bring down the inflammation in the whole body. Part of the problem there is that once we develop this inflammation in the gut, we often develop what's called leaky gut. And that's where there's so much inflammation in the gut that the gut cells, which ordinarily and healthy gut cells should be nice and tight and sealed and only allow microscopic particles into the bloodstream, such as nutrients and glucose, they become leaky. So they become, the gaps between the cells become larger. And now we're allowing things like food particles to leak into the bloodstream where they are not supposed to be, okay? So the immune system says, what the heck's going on? Why is this here? Starts flagging these food particles and mounting an immune response. First of all, that is going to cause us to develop food sensitivities or allergies. And secondly, that constant immune response, so your body's constantly flagging things that are leaking into your bloodstream, that is going to cause fatigue and inflammation. And the more that happens, it's going to impact your mental health, your energy levels, all kinds of things in your body. So if you've ever had your inflammation levels tested in a test called CRP, there's many different things they can do to measure inflammation. That's one of them. And your doctor has said that it's high, you really have to get both your blood sugar and your microbiome balanced out and under control in order to bring that inflammation level down and allow your body to do what it needs to do. So that means optimizing digestion and allowing your cells to bring in those nutrients to make that ATP so you have energy. So the other factor here with energy, if you're someone who's struggling with chronic fatigue, there's two other factors we have to talk about. Number one is blood sugar, which we did talk about already, but I want to circle back to it. If your blood sugar is yo-yoing throughout the day because you are skipping meals, you're super stressed, or you're living off processed crappy food, so you're drinking like a latte for breakfast and a bagel for lunch with like no protein, your blood sugar is going to be spiking and crashing all day. And that directly is going to impact your energy, your mood, and your focus and your ability to be productive at work. You're going to be cranky, you're going to gain weight, you're going to have inflammation, you're going to be tired no matter how much coffee you drink. We have to get that blood sugar under control. The final thing is your adrenal glands. And I kind of want to circle back to how this connects to hormones. So importantly, for those women who are, maybe 30s, 40s, starting the transition into perimenopause at some time, really need to hone in and listen to your body and focus on supporting your adrenal glands. So those are the glands that sit on top of your kidneys that produce stress hormones. When you're chronically stressed and you're doing too much all the time, your adrenal glands are constantly putting out stress hormones. But they can only do that for so long, right? They're going to reach a point of exhaustion where they say, I give up, I can't do this anymore, I'm overworked, and they just stop producing the hormones that you need. So cortisol gets a bad rap. That's one of the main stress hormones, but we actually need cortisol for energy, for proper immune function, and many other factors. So if we don't have enough cortisol, we're going to have chronic fatigue. And so what happens is in these people that have been chronically stressed for a long period of time, their adrenals can't keep up anymore. And now they're developing chronic fatigue and nothing is helping. So this is where we have to implement lifestyle changes and get more rest because without that, the body's not going to be able to recover. Okay, it's simply a fact that the body has been too stressed and too overworked for too long. The adrenals need to be nourished. And we can do things like using adrenal supplements, so that includes adaptogen herbs and nervine herbs, as well as other nutrients like vitamin C to nourish the adrenals, and certain dietary changes as well. But again, you can be doing all of the things, taking supplements, changing your diet, but if you are not getting the rest that you need, then you're never going to recover from adrenal fatigue. So why does that matter other than fatigue? It matters for your mental health, and it matters a huge impact on the aging process. So women that have adrenal fatigue, as they're starting to enter perimenopause and menopause, have a worse transition and a worse worsening of symptoms, right? So you can have a fairly smooth transition if everything is balanced in your body. But if you have adrenal fatigue, wacky blood sugar, imbalanced microbiome, you're gonna have a worse transition to perimenopause and menopause. And the number one reason for that is because as we transition, when we're younger, our body makes most of our sex hormones from our ovaries. As we transition into menopause, our sex hormones are now mostly made from our adrenal glands. So think about that. If your adrenal glands are burnt out and can't produce the hormones that we need them to produce those sex hormones as well as stress hormones, where are your hormones coming from in menopause, right? They're already going to be lower as it is because that just naturally happens. But if your adrenals are burnt out, you're not producing nearly enough hormones, and you're really going to need to work with someone like a naturopath, possibly get on some bioidentical hormones to replace those that your body can't make because you're so depleted and burnt out. So as I said, let's circle back and just honor our body's needs for rest. Yes, supplements and nutrition are important, but if you're not resting, your adrenals are going to become depleted, and it's going to make a much more rocky transition into perimenopause and menopause because that is what our body uses to build hormones at that phase in our life.